In this video, I'm going to go over joint mobilization techniques for the spine. So the first technique that we're going to do, we're going to start with a cervical spine. Now there's several techniques with this that I like, and I don't think that anyone is better maybe or more correct than another. It's just really your preference. So the first thing I'm going to do is come to Kinsley, the head over here. I'm going to go on each side of her thoracic spine, and I'm pushing forwards and down in that direction towards the front side of her pelvis. And I would just oscillate. I can hold this. I can take that into manipulation if your scope of practice allows manipulation. So I like that technique. I'd repeat that, 10, 15 repetitions. And how much pressure force do I use? Not a ton, especially if the patient's really sensitive right there. I like to kind of be easy with that. That's a good technique also at the CT junction right here if they're very sensitive. And so you can do that to try to mobilize a little bit and take a little pressure off of those joints and cause a little, tone modulation there. So I like that technique. The next one we're going to do, I like this one if the patient's having radicular symptoms down their arm. So what I'm going to do is I'm going to take my thumb, I'm going to hook it on the spinous process, and I'm going to push it towards the side that she's having the radiating symptoms. So in her case here, we're going to say it's her right arm. I hook the spinous process, and I'm pushing, and I may just work up and down the cervical spine all the way down to that CT junction, and I may hold that sustained pressure. I may kind of wiggle back and forth. You have to be careful with that because it can be sensitive, and so maybe a little pokey or a little uncomfortable, so you want to be easy with that. If just using your thumb is too uncomfortable for the patient, I'll use sometimes the heel of my hand and just go across like this and hold that pressure that way. So that's a great technique that I like to do if they're having radicular symptoms. The other is going to be a scooping technique with cervical spine. So with this, what I'm doing is I'm pushing down on the CT junction area. So I'm pushing down this way, and I'm going to take my hand and almost scoop and pull her occiput towards me. So I'm going to push down here, right? And then I'm going to take my hand here, and I'm going to scoop towards me. So I'm scooping towards me, and I'm pushing down at the same time. And I would just hold this maybe 10, 15 seconds, maybe even up to a minute if I can, although a minute's a pretty good long while to hold that. You have to be careful not to mash the patient's face, nose down into the mat or the couch or whatever you're using. So again, I like that technique. That's a good traction technique that you can do for somebody for the cervical spine. Now we're going to move down to the thoracic spine. So there's several techniques that you can do here. I don't necessarily, again, have one that's my favorite, but I do like to come in. We're going to start the first one. I take my hands kind of in this kind of shape here. And I'm going to go on both sides of Kinsley's thoracic spine. I'm going to push down and forward. So down and forwards. I can hold this. I can ask her to take a deep breath in, and then she kind of lets out. And as she exhales, I just kind of sink down with her. And that would be more of a grade 4 or arthrofascial, stretching. And so if you're using it for tone modulation, that's great. If you're trying to, gap the joint a little bit, that's fine too. You can take that into a manipulation or a grade 5 mobilization if your scope of practice allows. But again, for this purpose, I'm just showing just that gentle mobilization. Sometimes I'll oscillate. I'll work my, kind of way down the T-spine here and kind of oscillate. Now, when I originally learned this, especially because of the shape changes in the thoracic spine as far as the facets, the angles that's going on there with the vertebrae. And so I don't necessarily get too bogged down in exactly a certain degree because the angle's changing and all that. You can, and I'm not saying that's wrong. I learned it, being very, very specific with a lot of that. But in my experience, just for me, it's just as easy to kind of come in, just what feels right or what feels good to the patient, and then what feels comfortable for you. Now, a point I should make, I do have this, the mat table here higher than it would be if I were doing this on a patient for body mechanics purposes, because I don't want my hands up this high. I want to be able to stack the joints. I would have her lower to be doing these techniques, but for the camera, I have her raised up. So the next thing we're going to do is I'm going to take my hands like this on each side of the spinous processes here, and I'm going to go down, and I'm just rotating my hands kind of as she exhales, and then she'll relax. She takes a deep breath in, and then I'll go again, and I'll sink in. And again, I may oscillate, kind of bounce here a little bit. I'll do that for 5, 6 seconds, give her a break, let her breathe, because you want to give them an opportunity to breathe so you don't suffocate them with that. Then the next one that I like to do in the T-spine in this position, also incorporating the ribs a little bit, as I'll take my hand, kind of the heel of my hand here, and I'm going to push in, and I kind of come around on her ribs, and she relaxes, Takes a deep breath in, and as she exhales, then I'm going to go down and I'm pushing around. I'll take my other hand to stabilize for the wrist, and so I have my thumb kind of in this little trough right here, just on the other side of the spinous process there, that laminal groove there. So, not specific, I'm just get close, just get right off the spinous process. And I go in, and I just kind of work my way down with that to those lower thoracic vertebrae. Now moving on to the lumbar spine, there are several techniques I like with this. One that is so simple, and for a lot of people that are having a facet arthropathy, some sort of facet irritation, nerve root irritation, maybe they have lateral stenosis where the nerve roots are coming out, this technique works very, very well. So I'm going to take one hand, put it right at the top of Kinsley's sacrum here. I'm pushing down into the mat. My other hand, I'm going to go right on that bottom of the thoracic spine curve, and I'm going to push upwards. So I'm doing this with my hands. Just a gentle, I'm just going to press here. She exhales. I can let her relax. I can go back in. I can kind of bounce or oscillate this. You can get as aggressive with this as you'd like. Usually I don't push that hard, just a little bit of pressure and relax. I'm almost just taking up the skin slack with that. So I do like that technique, and I'd spend a few minutes doing that. Maybe I repeat that 3 or 4 times. Then what I'm going to do is I'm going to come around and grab on her ASIS here. Obviously, I always get permission from the patient to reach around their pelvis. So I'm going to come around, take one hand right here. So I've got that bony spot of her pelvis. I'm going to pull that to me, and at the same time, I'm going to take my other hand on her ribs, just on the same side as this hand of the spine, and I'm pushing away from me, and I would just kind of hold it. I may rock that back and forth, just kind of oscillate back and forth. That's a good technique that usually will give some alleviation in that lumbopelvic region. And so now the other one that you can do is also just direct P to A, so posterior to anterior. Now, also can do this in the cervical spine, and just using your thumb and just kind of pushing down in that cervical spine area. For the lumbar, I usually will take this area of my hand here, almost like a knife edge, and I will go in, and then I'll reinforce with my other hand and just kind of push down. If that's really sensitive, maybe I take my hand in this position so that my fingers are pointing upwards, and I press down, entire hand that way. And again, she would be lower, and I would reinforce my joints when I did this. Now, working all the way down to the sacrum and the SI joints, there are a couple of techniques here that I like. One is going to be, I'm going to go on both sides of her PSIS bones here. I'm going to take my hands and I'm spreading apart, so I'm pushing down and apart, just trying to create a little bit of force through the SI joints here. I don't know as far as, I know that there's theories of how much you can gap the SI joints. I don't think, based on research, you could do a lot of true gapping because those joints are very, very stiff and rigid. And I mean, there is some movement that occurs. I think more of transfer force of movement more than anything. But I just like that technique. That does really well for someone who's having SIJ pain right there. And then we're going to go down to the sacrum. So I'm going to take my hand, fingers pointing up, go right on the top of the sacrum, reinforce my wrist, and I push straight down. Now the trick with that is you got to make sure that your hand is in the right position so that you get a little bit of that mobilization of the sacrum as it passes between the iliums of the pelvis. So I'm just pushing down here. And then I would oscillate the same way with that. So again, those are just some techniques that you can do in the prone position for the cervical, thoracic, lumbar, and sacral areas of the spine.